Well, good morning. There's always the advantages and disadvantages of being the last speaker. And so certainly the advantage is that most of the other presentations have already covered what I was going to cover, and so that's a good thing. And then the disadvantage is that usually you stand between the audience and a break or lunch. So I happen to have both, and so I do plan on making sure that I leverage that, and anything that has already been covered, I will not go into detail. And the other good news is that I didn't bring up my laptop with my notes, so that's a good thing too. So NorthPoint Health and Wellness Center, we are located in Hennepin County in the state of Minnesota, and we are in North Minneapolis. So I was happy to hear part of our motto being used, and our motto is making health happen in North Minneapolis. We also say that health happens in healthy communities. We also incorporate art into our clinic, and so we have an art gallery, and it's a public art gallery, and the tagline that we have for that is that art happens in healthy communities. So we are a health center, a federally qualified health center that has been focused on population health, community health for a long time, and certainly focused on North Minneapolis. So North Minneapolis, according to the 2010 census, over 57,000 individuals. 82% of the residents of North Minneapolis are from communities of color, predominantly African American, Latino, Hmong. We have, I believe, the largest Hmong population in the state of Minnesota. Recently, increase of Somali population as well. Most of the families have incomes that are well below 275% of the federal poverty level. And of course, with all of this comes the companion piece, which is large amount of health disparities, economic disparities, high unemployment rate, and high foreclosure rates. So as you've heard people talk about social determinants of health, you know why all of this is linked. We've been around about 45 years. We are a federally qualified health center that we are connected with Hennepin County, so we are called a public entity, federally qualified health center. And for those of you who are familiar with community health centers, I always say that we truly are the community health center because our governing board is required that 51% of our board members are patients. And because we are part of Hennepin County, all of our employees, for the most part, are Hennepin County employees, and I am a Hennepin County employee. However, I report to the community board, and so oftentimes I have to bring that up with many of my colleagues, and sometimes with the county commissioners, that, oh, you know, I report to the community board, and, you know, it's truly community governed, truly community driven. We are also a model of integrated health and social services. We have a patient base of over 23,000 patients with about 84,000 visits annually. We are the second largest FQHC in the state of Minnesota, and there are 17 in the state. So we have medical, dental, we have behavioral health. We also have a nonprofit that our community board operates. In that nonprofit, we have a food shelf, we have housing, we do employment, community outreach through our community health department, which is largely through our community health workers. We also are a MICD treatment center, which is mental illness and chemical dependency. We also have an on-site pharmacy, and we also provide transportation to our patients. We recently developed a strategic plan, and we believed that these were the areas that we really needed to focus in on if we were going to have any kind of impact in terms of, we always talk about moving the needle in terms of health outcomes. And certainly primary care, wanting to make sure that The first entry into the healthcare system for any resident was through primary care as opposed to the hospital or the emergency room, focusing on community health, making sure that we are looking at the big picture and how are we coordinating all of those components within North Minneapolis and drawing them back into how that has an impact on health. And then certainly the social determinants of health we are focused on. And then health equity, that is making sure that everyone has an opportunity to have access to health, making sure one of the things that we do in conjunction with the University of Minnesota is that we provide training opportunities, we provide scholarships, particularly for those students of color that want to enter into the health career. And we have many of our doctors and providers that on Saturdays they go out and they work with young people as young as 9 and 10, helping them so that they make choices not only about math and science, but choices into the health career. So what are we doing in terms of our strategic action? Well, we are a patient-centered healthcare home. We were the first community health center in the state of Minnesota to become one, and that allows us then to focus on those patients that have multiple diseases or other issues. We're able to, in the state of Minnesota, we receive reimbursement based on a tier system for patients that are enrolled in our healthcare home. They get additional care coordination. We have been using community health workers since 2005, and we have partnerships with a number of the community colleges, vocational schools. There's also in the state of Minnesota, and I think we're one of the few states that also have a reimbursement model for community health workers if the face-to-face interaction is something that has been ordered by a healthcare provider. And then there's this whole idea of collective impact. And it's a new buzzword, and we finally realized, wow, a lot of the stuff that we've been doing is around community health collective impact. So some of the projects that we have that involve convening large groups of community members, bringing in partners, really are around this whole idea of community collective impact. So our Breathe Free North and Tobacco Control project, excuse me, is one that is focused on not only providing smoke-free environments, and in fact, within Hennepin County, our clinic was the first clinic to become totally smoke-free, and we were able to convince the entire Hennepin County government that they should also be smoke-free from curb to curb. So that includes parking lots, anything that the Hennepin County owns, you cannot smoke. And so we thought that that was a major coup in our arsenal. But also being able to go out now and work with stores and making sure that they are in compliance, and working with rental housing and making sure that they understand the implications of having smokers in their buildings, and making sure they understand the savings that if they were to go smoke-free, and talking with those landlords. Northside Fresh is an initiative that we have of increasing the accessibility of fresh food in North Minneapolis. North Minneapolis is considered a food desert. We don't have we have one major grocery store, and the fact that making sure that people can look at urban gardening and understand where their food comes from and how their food is manufactured. And so Northside Fresh is a coalition of about 30 different organizations, including the city of Minneapolis. And we're just getting ready to enter into a new partnership on a chlamydia partnership. We have one of the highest rates of STDs and chlamydia in the state. And our clinic has one of the highest screening rates. So we screen a lot of people, but we're not making as big of an impact on reducing the chlamydia infections. So this is a partnership where we're actually partnering with the community. And so we're using the skills that we have learned in terms of community engagement and bringing the community in to talk about what are some of the innovative ways that we can reduce the chlamydia infection within this community. So we're starting off with focus groups, we're working with families, we're working with community centers, anyone that will come to the table that we can bring around discussing how do we prevent chlamydia. This is something that our Fit for Fun event that I'm most proud of. This is our going on our second year of doing this, and this came about because of our providers. Our clinicians felt like that there really was no place in North Minneapolis where families could exercise, even though the city of Minneapolis was recently awarded, I think, one of the healthiest cities in the country. There's always the asterisk that talks about North Minneapolis, but within the city of Minneapolis, there is parks and opportunities for physical activity. However, getting people engaged is a whole nother issue. So what our providers decided to do was to put on this community event that they call Fit for Fun, and it's free. And they had all kinds of opportunities for people to come out and to exercise, to learn about healthy food. We have a partnership with a bicycle club called the Major Taylor Cycling Club, and they did bicycle rides. We have a bicycle repair shop, and they came out, and not only did they repair bikes, but they also would give away used bikes. We were also able to, through generous donations of foundations, give away new bikes to families, only if they participated in at least 2 of the healthy events. So this event far exceeded all of our expectations. We were thinking we were going to get maybe 100 people, maybe 200. We had over 700 people that participated. And just to tell you how popular this event is, on my way here, I saw some folks from Minneapolis in the airport, and they ran up to me and said, "Are you going to do that again? Are you going to have that event?" And I said, "You mean Fit for Fun?" They said, "Absolutely. We want to sign up. We want to come again." And so I said, "Absolutely, and we'll make sure that you are there." So around health equity, one of the things that we do is that we want to make sure that people understand that culture and ethnicity also is an advantage, and it's one of the things that you can utilize to promote healthy behavior. So we have a number of different events that do that for not only for our patients, but also for our providers. So See, Test, and Treat is where we have specific cancer screenings that are same-day results, and they are based around different cultural groups. Cultural Care Connection is an online assessment that our staff can go and learn how they can be more culturally appropriate and learn about where they stand in terms of being able to relate to different cultural groups. We do patient listening groups based on different ethnicities as well as collecting the data. Now, one of the newest innovative ventures that we are part of is called Hennepin Health, and this is a integrated healthcare network that is really a demonstration product that's part of the ACO. We are one of 4 partners in Hennepin County, so the Hennepin County Medical Center, which is a level 1 trauma center, and then the Human Services Public Health Department, which is the social services and the public health department for the county, and then the Metropolitan Health Plan, which is Hennepin County's health plan. So we have joined forces for this partnership. So the population that this demonstration project is on the MA expansion population in Hennepin County, the ages 21 to 64-year-old adults that do not have dependent children, at or below 75% of the federal poverty level. And we're targeting about 10,000 members per month, and we are just now entering our second year. And so one of the things that we've certainly identified with this population is that there was high need, and that there were about 5% that were utilizing 64% of the dollars, pretty much what you've heard before. And they were pretty much crisis-driven. There was a lot of fragmentation within the system, and that there was a lot of cost shifting. We also found that there really were not really good solutions, but we did identify some of these solutions, certainly addressing the social disparities, improving patient outcomes was something that we knew we had to do. We had to increase system efficiencies, and we definitely had to increase preventative care. So with our partners, we were able to, in the first year, have some really good results, and we actually had shared savings, and we were able to take some of those savings and put them back into the system. So one of our goals was to reduce inpatient admissions by 10%. We decreased it by 14%. Reduced emergency room utilization by 10%. We actually decreased it by 13%. And then the triple aim, patient satisfaction. It doesn't really matter if people aren't really satisfied with what they were getting. We were able to get 87% of those patients that said that they would be likely to recommend Hennepin Health to family and friends. And then, of course, reducing costs. Our goal was by 2%. We actually reduced the costs by 5%. In addition, all of the partners were able to cover all of their additional costs that we had to put into the system, as well as the shared savings. And so with those shared savings, what we're doing in year 2 is that we're going to be putting this back into the system. And so we have identified projects that we believe are going to be 30 to 80% allow us cost reductions. A sobering center is something that's pretty innovative, and one of the things that we found is that, and I'm sure it's in other cities as well, is that a number of folks that end up in the emergency room just need to sober up. And why not have a low-cost place where they can sober up and also get the type of medical supervision that they need? So we are building, I shouldn't say building, but investing in repurposing a center so that we can use it as a sobering center. Housing, no surprise, is a major, major issue. Behavioral health, definitely you heard that before, and it's no different in Hennepin County, a number of people coming in that are in behavioral health crisis. Intensive primary care, being able to focus on those folks that are having multiple hospitalizations and readmits. How do you make sure that you're able to reduce that? And then vocational services. We're going to be putting investment in job training and job creation as well. So opportunities in population health, we are also part of the Community Transformation Grant. Health exchanges, we start as well in October. And certainly innovation funding, Minnesota was a recipient of one of the SIM grants, so we've got about $45 million that through our State Department of Health and Human Services, we're looking at how we can use that money to impact some of these issues. And then increased collaboration between providers and payers. We certainly found that that was beneficial in Hennepin Health. Certainly one of the challenges that we have is data sharing. We are all part of one electronic health system, but we found that sharing data between the social services and the health services is a major, major issue. And I'm getting the red light, so I'm going to say thank you. And this is one of our residents from Fit for Fun riding off on his new bicycle. So thank you very much.
Thank you, Stella. And all full disclosure, I have been fortunate to be on Stella's the NorthPoint board, and you can see why I'm just honored to be there and serve under her leadership. So we are now going to have a break. So it's a 10-minute break, so check your watches, and should be back here at, what, about 12 till? Is that about right? Is that Lena, I'm looking for some direction. Is that about right? About 7 till, okay. All right, so 7 till. I was off by. So take a break, come back, and we'll have some great time for discussion and questions. So think about what you'd like to point out and or ask the panel.